Now, this is a very one more interesting ECGs of the same patient on the same day. So you can simply pause the video and you can try to find out what is the problem in this ECG. Now, these are the ECG of the same patient. Now, what we need to understand is here the heart rate is around 80. Here also the heart rate is around 80, and the heart rate around here is 112 to 115. So the patient had presented with chest pain. Now, this is the first ECG, this is second, this is third. Now, I want to show the important thing is you look at the lead 2, 3, and AVF. These three leads you can see. Now, when we zoom in, what we can see is we can very nicely make P wave, P wave. We can see the P wave which is here, P wave which is here, P wave which is here. Now look at the T wave, that is the uh, wave after QRS. This is the T, and you can very well see that T is inverted. The T is down going. Here also the T wave is like this. Here also the T wave is like this. So the T wave is negative. So T wave is negative. Here also T wave is negative, or T wave inversion is there. Here also you can see that the T wave inversion is there, which is not seen in here. Here the T wave is more of positive. The T wave is more of a positive. Here also the T wave is positive. So here it is very well that the T wave is positive. So it is the same patient with uh, inversion of T wave in one ECG which is positive and in one ECG which is negative. So what we call it as is dynamic changes. Means patient may have ongoing ischemic heart disease, or patient may have ongoing ischemic coronary artery disease that very commonly cause T inversion. So presence or new onset of T inversion can significantly indicate that patient may have coronary artery disease. The other things which can tell us about the ischemic heart disease is ST depression or significant T wave inversion. Now, this is the ECG of the same patient where we can see that when the heart rate of this patient was increased, when patient was having higher heart rate, we can see the same ECG is not showing a ST depression. You can see that this is lead 2, 3, and AVF here. Instead of here, the ST segment was more of a flat. There was very minor T wave inversion, but here the ST is down sloping. This is down sloping, and T inversion is definitely there. In fact, there is a very subtle ST depression also. If this is the baseline, we can see that this is the baseline, and there is actually 1 millimeter ST depression, and this ST depression is down sloping. Now we must know that the ST depression can be of three types. Either it can be straight, it can be down sloping, or it can be upsloping. The most important thing which tells about ischemia is flattening or horizontal ST depression, and second is downsloping. The upsloping is kind of the least significant for ischemic heart disease or coronary artery disease. So the same patient, when the heart rate is high, it is showing downsloping ST depression, T wave inversion, and ST depression of more than 1 millimeter, which is significant for the coronary artery disease. And this patient actually had right coronary artery significant disease. So this patient had almost 90% right coronary artery blockage, and for which the angioplasty was done. Again, what we can see in other leads like V4, V5, and V6, that there is kind of, this is a baseline. This is baseline. So this patient had ST depression of around 1 millimeter, and there was a pretty good T wave inversion. So the T wave inversion was there, and there was ST depression of around 1 millimeter, which we can see clearly when the heart rate was around 80. The same thing here in the second ECGs. And but in the third ECGs, when the heart rate was high, it was around 112, the same ECG was showing significant ST depression. So the ST depression in earlier ECGs was hardly 1 millimeter, but in these ECG it was 1, 2, 3, 4. So there is significantly, markedly uh, new occurrence of ST depression with T wave inversion, which highly suggests coronary artery disease. So basically, this patient had the presence of not only RCA, but this patient also had involvement of left anterior descending artery involvement as well. So this patient had actually double vessel disease, and this was very much apparent from the ECG as well. That's all. Thank you.